We all know our society is ageing. We see it with family and friends who are suddenly living to ages we would have thought was most unlikely in the past. We looked at the figures, the forecasts from official demographers, and they showed a remarkable picture. They showed, for example, that the number of people 65 plus will increase by 50% and the number of people 85 plus will increase by over 100% by 2030. These are very big shifts in our society in a short period of time, and they have quite a number of consequences. Another way of looking at it would be to look at the forecast of the number, how long babies will live who were born a few years ago, in 2007. We expect that 50% of them will live to be more than 100. This is not the world we've been used to in the past, and it has some very big effects. It clearly has effects and implications for our pensions policy. How do we sustain ourselves in later life? And it has big impacts for our employment. How do we and should we, if we want to, be able to work longer? The impact of an ageing population on our health and social care services is particularly dramatic. In a relatively short period of time, by 2020 to 2030, we will see remarkably big increases in many of the conditions that older people can have. For example, diabetes, dementia, coronary heart diseases. You can't not switch on the radio now without noticing some report about the increase in demand for these services. And this will require significant shifts in the way our health and social care services work for the future. The big conclusion of our report is that for most people, for most of their lives, additional years and longer years life is potentially a wonderful gift. So we should not see this as a problem by itself. But there are challenges, and we look in our report at some of the challenges that we think we will all have to face, and that we think particularly government should wake up to and face itself. And that's what our report explores.